Hello and welcome to Part 4, Obamacare Alternatives. Now, as this video is being recorded, the plan right now in Congress is to repeal Obamacare without any concrete alternative to that program offered. And the idea is that they would come up with something in 2 or 3 years. The program will continue perhaps for some period of time and there will be some kind of transition. But in the meantime, there really isn't a whole lot of certainty given to the insurance marketplace and to the people who are now covered under the Obamacare program. In fact, it's quite likely that they're going to lose their coverage. At least there will be millions and millions of people who will lose their coverage as a result of these changes. So I just had to say that the approach that's being taken now is frankly irresponsible. And I do hope that the Republicans come to their senses around this, because at the very least, we need to be creating more certainty to the markets, as well as helping the millions of people who are being affected by this. And even President-elect Trump has said that he wants to see some kind of a result where there's a plan at least to replace Obamacare. So let's talk a little bit about the Republican plan. Now, such a plan really doesn't exist. Right now, there are a lot of different ideas, and what I can share with you now are some broad idea of the direction that might take place. Now, I want you to bear in mind that none of these plans are going to target the millions of people who now are benefiting from the Affordable Care Act, especially the ones in the Medicaid expansion. Second, the plans that I've so far seen don't say anything about quality of service. Now, there's some kind of lip service that's given that this is going to improve overall quality and reduce premiums, et cetera, but there's frankly nothing tangible that would allow that to be achieved. So, until I see something specific, then I can't say that any of that is happening. And then the third thing is that in Part 1, we talked about some of the areas that could be improved to make our American system better and at least make it more comparable to other developed countries in the world. And frankly, none of that is on the table. And that's a worry, because even from the perspective of Republicans who are very cost conscious in these sorts of things, there's really nothing that's going to affect the overall system of healthcare in this country to contain those things. What they will focus on is around containing federal involvement and federal costs, which means that it's going to be pushed down to the states, to localities, and it may still affect the pocketbook of every American just as much as before. It's just that it won't be under the auspices of a federal program. So what are the specifics being offered? One pretty widely acknowledged area will be around increasing health savings accounts. So those exist today, but they have a lower cap. And the idea is that the cap is going to be increased and that people will be able to accumulate the amounts that are in those accounts and be able to save over a period of time for, say, a larger healthcare expense. So this is something that will primarily benefit people who can accumulate money in those accounts. So you have to have money to be able to put money into those accounts and benefit from the tax advantage status of the money that's in there. Now, one thing that bothers me about health savings accounts, and I haven't heard this so much in the news yet, is that if you think about the way that employers help their employees today with the kind of plans that are out there, those are a plan that's under a defined kind of benefit for people. You get a prospectus, you know what your benefits are, you read the little summaries, etc. But what employers could do instead is to simply put money into the individual health savings accounts on behalf of their employees. And this would be a way for them to have a defined cap on the benefits to people. And this is much in the same vein as what happened when people moved from pensions to 401ks. And we know that this is something where, in down years, employers can reduce the benefits, and et cetera. I worry about this option. I like it in principle around health savings accounts, but I think it's going to have some unintended consequences that we're going to see down the road. And in particular, this will happen because one of the Obamacare provisions is around the employer mandate, which requires a certain set of benefits that are part of that healthcare coverage. And so if those are gone, they have a lot more discretion to reduce their exposure. And that could include contributions to a health savings account or dropping coverage completely. So kind of be aware of that. Now, the final idea I wanted to talk about are age-based tax credits. This is an idea that's a key contribution from Tom Price, who is Donald Trump's pick to run Health and Human Services. Now, on the face of it, it seems very reasonable because if you think about it, people who are younger would have fewer premiums than people who are older. So it makes sense to have tax credits that are often based on age. However, this is not just something that's being added to our existing system. And if it were, I think it sounds quite reasonable. It's actually being used, though, as replacement for the tax credits that exist under Obamacare, as well as for the Medicaid expansion. And as a result, there are definite winners and losers here. So if you look at the total amount that is being planned to spend for those tax credits, it's a much smaller pool of money. And it's also something that's available across all households and all individuals. And so the net result is that the winners will be people who are upper middle class and wealthy because they would be getting a credit that they otherwise would not. And the big losers are going to be the lower middle class and middle class people who now get larger tax credits than what is being offered. So this is a pretty big change here. So I wanted to take this opportunity to share a little bit about Tom Price's philosophy about healthcare in this country. And it's important because his ideas are going to influence Donald Trump quite a bit and how the overall plan is going to take shape as a replacement for Obamacare. So first of all, his idea is that insurance is really for managing high risk. And so the idea that we have today where insurance is meant to cover, a variety of services, including, annual checkups and screenings and things of that kind, is something that he's really not in favor of. It really should be intended only to manage catastrophic situations. And in fact, he really wants people to be more exposed to co-pays and have higher deductibles because he wants people to feel the price differences. So the idea is that we as individuals should be in the position of shopping for the best deals. We should be shopping for the cheaper doctors, the cheaper drugs, the cheaper services. And that's the way that we're going to be containing costs going forward. So it's going to mean as individuals that we will need to necessarily switch doctors, go to different hospitals. And it imagines a scenario where we're free to calculate where to find the best deals on all of these items. Now, I don't know about you, but I don't feel like, health care in this country is like shopping for a pair of blue jeans. I think that this idea is very tough. I mean, when you're in a situation where you need medical services, you just got to get it done. You don't have the time and there's no desire to do any of these things. So I think that it's going to be a struggle philosophically for people to really go along with these ideas. But you need to know that that's exactly where his thinking is headed. He feels that the government role should be very small, and all of the government programs, including Medicare and Medicaid, should be really turned more into a voucher system because he doesn't feel like the government should have any direct role in the doctor-patient relationship or the transaction between the two of them. And then in that vein, another area is around the block grant idea. So rather than being on the hook based upon program eligibility needs and having this pool of people where we fund it up to what the program says we should, there would be instead discretion around a fixed sum of money that's sent to the states. And that is a pool of money that, again, is easy to shrink or expand depending on the whims of what they want to do. Most of the plans that have been floated so far as proposals have very little money to help sick people. So it's going to help contain costs for the federal government, but it's going to also mean there are a lot of people who are going to have unreimbursed expenses, and that's going to have consequences. That could be another way that premiums get spread out and the costs get spread out to all of us. It's another way where people may end up going back to going to emergency rooms and getting their care that way. And again, having the cost for using emergency services, which is expensive, and have that cost, again, spread to all of us through increases in premiums. So it doesn't really amount to something that reduces costs. What it does do is it reduces the exposure of the federal government to those costs. So kind of be aware. That's really the direction the Republicans are making right now. Now, I want to make a quick comment about this because really, I don't want to make it sound like, it's either one or the other, it's either good or bad. What we're really talking about here are values and trade-offs. And the fact of the matter is that what Obamacare does fundamentally is it helps a group of people who otherwise would have no coverage whatsoever and tries to make it affordable for them to do so. And the trade-off is that the rest of us have to help a little bit more to help sustain that. So if we're focused on our own self-interest, we may very well say, that's not good enough because I'm not better off. But for all those people considering their self-interest, think about this. You may be young now, but you won't always be young. And over time, this is a program that's intended to help you all through until you're ready to reach Medicare age at age 65. How will you feel about costs as you get older? How will you feel about taking care of family members who benefit from having their costs be more affordable for them now? But if you look at it from the perspective of helping other people, as well as viewing health as a right, that as a universal right to be able to have access to healthcare. And if you think about it, healthcare is unique in the sense that people who are down on welfare are also assuming that the people involved can work. So sick people can't work. It should be a universal right for people to have access to healthcare because we can't, as citizens, participate in our overall economy if we don't have the means to do so by having bad health. So it seems that having some level of health care is a fundamental right that citizens should get as part of their ability to participate. That's my 2 cents on that, about the values. But seriously, this is something where each of us has to look to themselves for the kind of values that they have for this. And certainly Obamacare is not perfect, and there's a lot of work to be done. We haven't even gotten into the ways that we could have true alternatives that would help with the overall healthcare system and the costs, etc., that aren't even addressed in all of this. So overall, I hope that as a country that we start to have real discussions around the changes that are necessary for the U.S. healthcare system to try to make a system that's fair, that's balanced, that provides healthcare for everybody at a cost that can be afforded. So thank you very much for watching this video series.